Welcome to our very, very special guest, Dr. Sambataro, aka Dad, aka the OG Biohacker. Thanks for coming on.
Thank you for the invite. It's a pleasure. I'm excited.
Yeah.
I listen to you guys every week.
Aw, you haven't missed a single episode?
Nope. Not even the one on women's hormones.
Oh, thank you. So for all the times that we say, men, don't stop listening, this is for you too. He listened.
Yep. Makes me understand your mom better.
There you go. That's
Yeah.
exactly why we need men tuning in.
Right.
Yeah.
It helps. Yeah, we don't have
Perfect.
the issues that we don't have to deal with all that. I guess
Yeah,
the
we're
only thing
With
special.
all that.
well, no, I mean just the fluctuation. I mean, obviously we age, our testosterone levels lower, but other than that, we don't really have fluctuations in our hormones.
Yeah.
You know, not a cyclic.
Yeah, we are very different.
Yeah.
All right. Well, longtime listener and third-time guest, thanks for coming back on. So for anyone that has missed previous episodes with our dad, we had him on in season 1, where we talked a lot about the basics of biological dentistry, the dangers of silver fillings, root canals, fluoride, things like that. And then you came back on last year with Mom, where we talked a little bit more about I would say like the whole body connection to dentistry, a little bit about sleep apnea. I know Mom gave some great like dental hygiene tips. So we will link to both of those in the show notes for today's episode. If you missed those, go back, check those out. But today we're going to take a deeper dive on a couple of things. So sleep apnea, sleep disordered breathing, how that is all related to the dental sleep medicine component, what you're doing in that realm, Dad. And then also want to hear like maybe some exciting case studies that have happened with patients over the years.
Sure.
What's new and the latest and greatest in biological dentistry? It seems like it's always evolving. So I think this is like a great time to catch people up on 2023 biological dentistry news. So we have lots to cover today. Where should we start?
I don't know. We have like 5 hours.
Sure.
We could go on and on and on, but I think it's really wise just to take a wide perspective, like that 30,000-foot view that we all appreciate, but also like everything is connected. So it's probably all part of one larger conversation, right? So maybe what feels really important to you today? What's kind of over time really stood the test of time and has shown great importance with your entire practice?
Yeah, so I'll start with that global, and actually the name of the practice, the Julian Center for Comprehensive Dentistry. So what does that mean? Is that we're all inclusive. So versus say there are dentists who specialize just in sleep apnea or sleep medicine. There are dentists who specialize just in orthodontics. So we put it all together because I think it's really important that you piece those things and you don't send patients to this specialist and that specialist. So we get to see that global view and then piece it together because it is a step-by-step process. So as we look at that, what's happened over the years as sleep has become an integral part of the practice. And absolutely every single patient who comes in here, we talk about home sleep studies, we talk about sleep apnea, we talk about sleep disordered breathing, how it affects you, how it affects your children, what you can do to compensate for it, what you can do to treat it, what you can do to prevent it for children. So that has become a really important part because everything else that we do in dentistry lays upon that foundation. Because if we're doing any kind of dentistry on a patient who's not sleeping or who is gasping for air because they have constricted airway or they have narrow arches, all that's going to compromise the ultimate result. And just for example, say I was to do a full rehab on a patient, just a full mouth of fillings and bridges or crowns, whatever, but they're clenching their teeth. And so they're going to start breaking these restorations. So one, that's not a good result. Two, that's a very unhappy patient. They're going to be very unhappy. And it's our responsibility to have addressed the underlying core problem prior to that, because we now know, and there's no excuse at this point, because we really do know now that one of the number one reasons for clenching or grinding is sleep apnea. So during that apneic event, our body compensates by trying to clench its teeth to help open the airway. I mean, there are other things too. Cranial imbalances, even parasites can cause people to clench and grind their teeth. But from a dental perspective, we have to at least rule that out before we go on to say the next phase. And it's the same as I'd say the other foundational thing is periodontal disease. If we're building a house on a weak foundation, it's going to collapse. So we got to make sure that their bone health is good. We got to make sure their gums are healthy. And that's where, what you two do in terms of nutritional background really makes a difference. You got to have that foundation. So trying, for example, to put an implant in someone who has osteopenia or osteoporosis, or even just a severe vitamin D deficiency, you're going to increase the risk of failure. So it's not just that, then people think dentists are just mechanics. So like, we're just doing mechanical things. We're going to drill a hole, put an implant in there. But what's going to happen long term if we're not treating the underlying foundation? So that was kind of global picture. Then bringing in, we can talk a little more about, how we address sleep, and from infancy to, as I say, from infancy to whatever, 90 years old.
Yeah. That's interesting what you said about the mechanic. If you think about like a car mechanic compared to a dentist, it's like if you're just going in and like, maybe putting in a new, I don't know cars by any means, you're just putting in a new engine, but then you're not also changing the oil and changing the brakes and doing all the other things, then you might get mad at the mechanic and say, hey, why did this go bad? And it's like, because you're not doing all your other work. So same thing, like you put an implant in, but you're not doing all the nutrition and lifestyle stuff. People are maybe going to get mad at the dentist, but it's not the dentist's fault.
Right. And it's interesting you say that, because some people will say, like, when I'm using a torque wrench to torque down the implant, they go, wow, that's like a torque wrench for your valves, tightening your valves or your spark plugs. I'm like, yeah, it's a little different. We didn't get this from Home Depot. So
you went to a little more schooling as well.
Yeah. And I think the other important point about that is we're a biological system, whereas a car doesn't have those other underlying systems, whether it's genetics or digestive issues or other systemic infections. So, so that is strictly mechanical. But yeah, you're right. So if you're going in for whatever, to plug your tire because you got a hole in it, but the front end alignment is off, I mean, it's just the problem's gonna come back. So
yeah. Holistic is so important. So, sorry, I didn't know if you were gonna ask a question, Laura. I'll jump back. Okay. Oh, no, I had just asked one. Or I guess made a comment. Yeah. So I think back to the sleep apnea issue, I feel like a lot of people have no idea if this is a problem for them. So like, how would you tell someone, or what would you tell them to look out for? Are there certain signs or symptoms? Like, where do we begin?
Yeah. Well, everyone comes in for a comprehensive workup, and one of the questionnaires, or two of them, one of them is, well, actually there's two that deal strictly with sleep. One's the Epworth sleepiness. So if they have a high number on that, we suspect that. Two, we're looking at their medical history and then ask them, did you clench or grind? Do you wake up? Has anyone told you you're snoring? And then the other one deals with TMJ issues. So because a lot of times TMJ issues are because you're clenching because you got an airway issue. So if we address just the TMJ issue, which we used to do, in fact, back in the 90s, they used to do a lot of surgeries to correct whatever derangement was going on in the joint, and they failed miserably. One, because they were inserting an artificial disc or cartilage over the joint, and plus they weren't dealing with the underlying problem, which was clenching or grinding. So, so that's the first part, and then we will ask the patient, and in many cases they deny. They're
I'm sure.
Yeah.
So one of the questions,
call their spouse or partner.
Right? Has your spouse told you, or your significant other, have they told you that you snore? Well, they say I snore a little bit. I said, well, how does your significant other sleep? Oh, they sleep like a log. I said, well, so they don't know necessarily what's going on. And I'll tell a little story. We had a patient, I think he was about 60, around 60, in the 60s, mid 60s. Nowhere, he wasn't married, never had a girlfriend, lived alone, went to a family function, and someone recorded him sleeping. And then the decibels were so high that, they were all laughing, making fun of it. So him not even really thinking of it told us this story. And I said, oh my God, we need to test this guy. I don't know why we didn't. I think because he had been a patient so long, he hadn't come through the same a pathway that most people do now. Sent him home with a sleep study. His AHI, apnea hypopnea index, was 65. So 5 and under is normal, 5 to 15, mild, 15 to 30, moderate, above 30, severe, above
Insane.
45 is outrageous.
Wow.
So this guy was one night away from a severe heart attack or stroke. So I think that kind of answers it, the question, how do we know? Because people are in denial. And I think there's some, I don't know, sort of a enigma that we don't fully understand, and people just don't want to admit that, like it's a bad thing, It's like a man saying he cries, right? Every man never wants to say he cries because it's too emotional, And I see this more for men. Men don't want to actually admit that they have a sleep issue or that they snore. So it's generally the spouse that's telling us about the husband.
Yeah. We've made fun of snoring for so long. Of course, people don't want to come forward. And that also means that potentially not something's wrong with you, but there is work to be done. So
Right.
then you have an opportunity where you have to show up and do something about it. And that's scary for people as well. I'm curious, before even the sleep study, because we have a lot of listeners, obviously, that are super into wearables because we are, like the Oura Ring. What can we potentially spot with something as simple as a data wearable in terms of breathing through the night, obstruction, any dysfunction there?
Well, I think probably the most valuable metric there is the pulse ox. So what's happening to your oxygen levels? Because and I've learned this more from you and your guest on there, that REM is not always that accurate. Deep sleep is probably more accurate, but obviously you can look at those things too. If someone's got no deep sleep and no REM, they probably have a sleep, but that doesn't tell you if it's it could be insomnia. It could be some other sleep disorder breathing. It could be upper airway resistance. But if their pulse ox is dropping throughout the night, they probably have an obstructed airway. Either that or someone's choking them while they're sleeping, which is a whole nother problem.
And what would categorize it as dropping or being too low? Like what kind of numbers are we looking at?
Well, I can tell you because we monitor all our surgical patients. When our patients are having surgery done, we put on pulse ox and blood pressure and heart rate. If anything drops below 91, we get concerned. So immediately I stop the procedure, have the patient take some deep breaths, try to bring their pulse ox back up to 98, 99, or even 100. So throughout the night, so I've seen pulse ox levels as low as high 60s, low 70s on these sleep studies. So that's horrendous. And they talked about that quite a bit during COVID, about that being one of the most important things is what's your pulse ox. And I remember when I had COVID, that was certainly mom's concern because my pulse ox was running around 88. No matter what I do, I couldn't get it up. So that's when I went to the office and got the oxygen tank and started doing oxygen myself. And it was interesting that while I was on oxygen, I could bring the pulse ox back up to 98, 99. As soon as I turned it off, went back to 88. So
that's wild. Do you ever give patients oxygen during treatment?
Oh yeah. Yeah. So we'll always give it if we're doing of course with nitrous, so you always give oxygen as part of it. But we also give it if we're doing any kind of ozone treatment, because we don't want them to be inhaling the ozone. So they'll be on oxygen. And sometimes we'll just put it on somebody comes in, for example, with a headache. Great remedy for a headache. Just put them on 100% oxygen. It perfuses and reduces the hypoxia to the brain, and the headache goes away. So it's pretty cool. It's pretty miraculous because they're a little bit hesitant. No, I don't believe that's going to help my headache. And they go, "Wow, my headache's gone." I said, "Told you." So that happens.
That's a good hack.
Yeah.
How often do you think that headaches or migraines are hypoxia related? It may be an overly simplistic question, but
yeah, that's a good. I don't have an answer because there's so many. Headaches
so many
are
causes for it. Yeah.
Stress, hormonal, diet, got hit in the head, cranial issues, clenching can certainly cause headaches. I remember one of the first appliances we used for migraines was just a anterior deprogrammer. We put it on the front teeth so that they couldn't touch their back teeth at all, and migraines would go away. It was actually a classified medical device for migraines. So obviously there's many other reasons for that.
Most likely a byproduct of the structure, airway structure, jaw structure first, then we're not
Yeah.
getting oxygen.
Yeah. So, yeah, so that's a tough issue. That's, people come in and I say, well, we can address this, because a lot of times they're like, I've done this and I've done that and nothing helped. I said, well, let's just try it. Let's put you on oxygen, see if that helps. Okay, let's put you on an anterior deprogram and see if that helps. So, but as you are well aware of, and your listeners and also your guests, is that there's no panacea. People want guarantees, like with everything you do, like if you do this, I'm going to spend this much money and I don't know if it's going to work. So that's sometimes the challenge, which is why in the sleep arena, we use in-office temporary mandibular advancement appliances. So it's very inexpensive. And so we'll put them on that, see how they're doing, maybe do another sleep study, see if it improves it before they go to the more permanent appliance, which is going to be a lot more costly. So that's a great way. The downside is sometimes they don't want to go to the permanent one. Well, why don't I just use this temporary one? So
Yeah, can you? Can you, or will it crack or what?
Yeah. With time, it's going to wear out. Yeah, it doesn't have the longevity of a permanent appliance. So, but if cost is an issue, finance are an issue, it's not a bit. You're still saving someone's life. So that's the most important thing. And you'd probably have to go through, I guess you could make even like maybe 10 temporaries before it was the cost of a permanent one. So it's not totally a bad idea. It's just they're not as custom made as the one that we would do from the lab. So
Got it. And so I think another reason maybe some people don't want to do a sleep study or find out if they have sleep apnea, they want to kind of just ignore it, is because they don't want to use a CPAP. I hear that all the time. Like, I'd rather just not know, because I'm not going to use the CPAP anyways. So
I
Right.
wouldn't want to use a CPAP.
I think I said this on one of the last one or the first one.
Yeah, on the last one. Yeah.
The comedian who said it's a perfect birth control. Yeah.
Yeah, you're like Darth Vader while you're sleeping. I can't imagine it's comfortable, but I have also heard from patients that it is a game changer, because when you are laying in bed wide awake all night, not breathing, when you finally get oxygen, you do sleep through the night. I'm sure it takes some time to adjust, but so for the people that don't want to use the CPAP, then the appliance is an option. And then you're also incorporating myofunctional therapy.
Right.
With that, can you explain how that works?
Yeah. So going back to the CPAP, I think the stats show only 30% of people will actually get a CPAP, wear them. But those who do, they're life changing. And if someone comes in the office, I know they have sleep apnea, they say they're wearing a CPAP, I don't talk them out of it. I absolutely do not talk about it. Now, if they say I don't want to wear it anymore, so the insurance company's got smart and said, well, you got to at least wear it for 90 days before we will approve a dental appliance. So and then there's different types of appliances. So one appliance, which is fairly traditional for most dentists doing sleep who don't have a lot of experience, it's called a mandibular advancement appliance. So basically what it's doing, it sounds like it's moving your jaw forward, but really what it's doing is keeping your tongue from falling into the back of your throat. So it's holding your jaw forward, the tongue's attached to it. So the tongue, because that's the biggest obstruction. So two obstructions is the nasal obstruction and the tongue are the two biggest obstructions for sleep apnea. So that's a mandibular advancement appliance. Again, it's like the CPAP. You're gonna have to wear it forever. It's going to be every night. You got to travel with it. It'll break. It'll have to be repaired. So there's some downside to it. It's a little less expensive. It's not as much of a commitment. And then my favorite, or our favorite, and I would say this is with more advanced dentists, is 3D expansion. There's a couple of appliances out there, the Vivos, which was called the DNA, which stand for daytime, nighttime appliance. And then the FDA said, no, you can't call it that because it sounds like it's epigenetic. And actually it was epigenetic. So, but they use that. So they changed it and called it the Vivos. Vivos became this big corporate entity. So they made all these promises. We're going to advertise, if you become a member, we'll advertise on the Super Bowl time. And they never did all that. So I started looking for other appliances and I came upon this, what's called the HomeoBlock. And the HomeoBlock is actually the precursor to the Vivos appliance. And I like it so much better. So the whole idea behind that is, and I'm going to take a few steps back. Let's go back to, like infancy. So what's happening upon birth? So many times in today's modern time, we're not breastfeeding our children. So breastfeeding activates, stimulates the neuromuscular system in the face and jaw to allow growth of the bones. So the jaw bones do not meet their full potential if that's not happening. In addition, the introduction of, when they can actually chew, introduction of foods that require chewing, not these soft, gooey stuff that they're selling, which is probably not nutritious anyway. So that whole activation is what will stimulate it. So we see a lot of children who have not had that opportunity to breastfeed or have not had the opportunity to eat real food, have real narrow jaws. So this is the primary number one reason for the increase or explosion, I should say, of orthodontics. Because it's not that we have too many teeth. We have the same number of teeth as our ancestors. Our jaws have gotten smaller. So, and I'm a perfect example because I was never breastfed. And I have narrow jaws. I'm actually expanding them. I had 4 teeth taken out because there wasn't enough room, and then put into braces, and everything's pulled back. There's actually a theory called extraction, retraction, regret syndrome. So teeth taken out, everything pushed back, pushes the tongue back further in the throat, and of course then everyone's regretful. I wish I never did that. No, you didn't know better. So and so it's interesting, that acronym, extraction, retraction, regret syndrome.
Yeah.
Yeah.
Very funny.
Yeah.
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 So
Yeah, that acronym is very hilarious. So I'm curious, what can we do for children as far as appliances?
yeah, it's excellent question, because that's something that's been challenging, because in the past we had to wait till they were like 6 years old and had their first permanent molars in, so that we could actually use some kind of appliance to attach to the teeth. But if we go back to infancy, what's the underlying cause? Is they're not being breastfed and they're not having the opportunity to eat solid foods. All that stimulates the neuromuscular system in the face and jaws. And it's probably the number one reason why you see this explosion in orthodontics. Kids needing braces because the jaws are not big enough. So we got to take teeth out and then straighten the teeth. And that's where kind of that acronym comes from: extraction, retraction, regret syndrome. So now we have a number of programs, and I'll just talk about the one we use in this office, but not that this is better. There's other similar programs. We use a Healthy Start, and was designed by an orthodontist. So you can treat a child as young as 2 years old. Now, we typically don't see them in the office till maybe they're 3, but we can tell even at that age that they're going to have some kind of crowding issues. And one of the easiest ways to see if their primary teeth are tight together, meaning there's no space. Of course, the parent thinks, wow, they got a perfect bite, right? No space. No, you want space between the primary teeth because the permanent teeth are that much larger. So we can put them into an appliance, which helps with the growth and development. And initially, how it's helping is by stimulating the myofunctional system. Okay, so tongue posture, lip posture, lip seal, swallowing, all these things are soft tissue issues that really are a result of not learning how to breastfeed, not learning where to put your tongue when you swallow, when you speak. So all these things become very problematic as they grow, because then if you then throw them in, let's say, to orthodontics, when I say orthodontics, I'm talking about braces, or now most common Invisalign, is you haven't really corrected the underlying foundational issue, which is 1, correcting the jaw size, and 2, getting the tongue position and posture and lip position, lip seal. All these things are important for long-term retention. And one of the things that we see quite common, probably 50% of all orthodontics being done now are on adults that had braces or orthodontics when they were teenagers. So what went wrong that now everything's collapsing? Now they're going through, and I've even had patients that, yeah, I've gone through it 3 or 4 times, and their teeth are crowded. I'm like, oh my God. Talking about frustration. And if you look at them, you go ahead and swallow, and I go, they can't swallow because they don't know where to put their tongue. Like, where's your tongue when you're swallowing? Or they have an anterior tongue thrust. All those things add to the underlying dysfunction, which then you'll see result in later, sometimes even sooner, teenagers and actually in children, sleep disordered breathing. So, and along with that sleep disordered breathing, especially in children, you see all these other things: ADD, ADHD, behavioral issues in school, nighttime wetting, thumb sucking, emotional issues, all these that seem to just disappear when we start to get the soft tissue in the right position and they're actually breathing and sleeping through the night.
That's
so
amazing.
I used to suck my thumb as a child. What was that doing? What was that ancestral need to suck?
The belief is that you're stimulating the cranial sacral system. So the upper jaw, which quite often is too narrow, there's a suture that runs right down the middle of it. So when you have incomplete structural growth, you don't get that full expansion and contraction and expansion. So putting the thumb up there actually helps. This is like, can be an orthodontic appliance. So,
is that why you let me do it for so long?
yes, I knew it was good for you.
I got to a certain age, and I think you and mom were like, enough. But I did it for a long time.
Yeah, well,
Yeah.
I mean, also there's then becomes a habit. So it's habitual, and that then can become detrimental to the long-term success. So there is a certain period of time, just like if you're using some specific pacifier. I mean, if you're 16 years old using a pacifier, there's something wrong.
Yeah.
Yeah.
That's questionable.
Maybe.
Yeah.
Questionable. Yeah. Well, it's funny because like the other extreme is Ryan, my husband. His teeth are so straight, and he had braces, I think, when he was maybe 8 years old, and he never wore a retainer.
Yeah.
And they're still straight and never needed braces again. I'm like, I feel like that is such a rare case.
Yeah.
He's an anomaly in a lot of situations.
It's
I know.
anomaly.
Ryan
It's a
Bells,
special case.
are you really human?
I think he's a
Tell us.
hybrid.
He's an alien from another planet, different dimension. Well, I don't know, I don't know whether he was breastfed or not, but when I look at his arch, he has that nice wide, what we call Gothic arch or kind of horseshoe shape. So that is what is actually we're trying to accomplish when we use appliances. Because once you expand the bone, the teeth aren't going to collapse back in. If the arches are still narrow, the teeth are going to collapse back in. And if you have not corrected the soft tissue, especially the tongue posture, then all that's going to cause reactivation of this orthodontic issue.
Mm.
No.
Mm-hmm.
Yeah. Yeah,
So,
I think Ryan was breastfed. I mean, he was like a water birth, breastfed, ate dirt as a kid. His mom, thanks
did
to
it
his
right.
mom. She did it
Yeah.
right.
He
Yeah.
did it so right.
Yeah.
I'm really curious, what are some other reasons for the tongue being in the suboptimal posture or just kind of getting in the way? Is that solely because of lack of breastfeeding? Is it lack of nutrients? What else are we seeing?
I would say the primary reason is because they didn't breastfeed. And if they were given a bottle, so there's a big difference in the sucking that occurs with the breast nipple versus the bottle. With the nipple, breast nipple, you're pressing the tongue up against the nipple, and that's what causes the release of the milk down the baby's throat. And a bottle, you're not pressing the tongue up against the palate. So you don't get that expansion. So that expansion that you're getting from breastfeeding is actually stimulating growth and development of the maxilla. The maxilla is really the biggest issue, not the mandible, because remember, the mandible actually moves. It's not part of the cranial system. So the mandible will act accordingly to what's happening in the upper jaw. So the upper jaw needs to be expanded, which also causes expansion of the nasal passages, improves breathing. But also, I think what's important, especially from your perspective, because this is a nutritional issue, what are kids fed things that are creating allergies? Food allergies, food intolerances at a young infant, what causes them what? To be clogged. They can't breathe through their nose. Here's the key, mouth breathing. Mouth breather, mouth breather. So
are the allergies causing the nasal constriction and then the mouth breathing, or is it okay? So it's not the poor jaw structure, tongue posture causing the constriction.
Sounds like chicken or the egg.
So when the maxilla is not up and round like I said, a U shape or horseshoe, it's more like this. This tip is pressing into what's called the vomer bone, which goes right into the nasal cavity. So so once you widen this, the nasal floor drops down and opens up the nasal passages. So, but you're not going to see that in someone who is eating foods that they're intolerant to. And the other thing then results, it's all the sequela. So once you're mouth breathing, what happens? Air is going to the back of the throat, causes inflammation and enlargement of the tonsils. Okay. So now you have another problem. So what do they do with that? Well, if you get
Take
strep,
'em
you
out.
put an antibiotic, or take them out, take those out, take out the adenoids, and now they have immune issues for the rest of their life. So you got to get to the core issue, which we're trying to do, I say, with the Healthy Start program, and that in conjunction with myofunctional therapy. So we now have a new hygienist here who is trained in myofunctional therapy. So she's working with these children in conjunction with the habit correctors from Healthy Start. Interesting is that in the early 90s, that's why you all call me the OG, right? I had a myofunctional therapist in my office in the early 90s because I was treating mostly orthodontics and TMJ. The state dental board actually called me out on it and wanted to know why I had a myofunctional therapist in my office. So
you're like, because I'm way ahead of the curve. That's why.
Yeah. Well, I politely answered them with information. My gut feeling was like, it's not my duty to educate you, educate yourself. So I understood the function of that, but it was interesting because I was doing that. I wasn't getting referrals from the orthodontics community for treating TMJ, which was really kind of my expertise then, because they thought I was just a little bit off the wall. What's myofunctional therapy? What do you mean you're not extracting teeth? What do you mean you're expanding the jaws? In fact, another story. So I know we'll get into some more stories, but this was the first time I ever was brought up to the state or had a lawsuit. Was I had a patient who was referred to me by a chiropractor because they had chronic headaches. So I put the patient into an expansion appliance. This was in early 90s. And her headaches went away. I mean, completely went away. She went then to her dentist, family dentist, and they freaked out. They said, what in the world is this dentist doing? Because when you do that expansion, the teeth aren't meeting anymore. Okay, that's why it's phase 1 expansion, phase 2 braces and or aligners or Invisalign. Okay, but that's all this dentist said. I hadn't gotten to phase 2. So make a long story short, when I was called in for deposition by the attorney, I brought in like a stack of information about jaw expansion and the purpose of it in 3D manipulation. And they were like, oh, we were told that this was some experimental thing that you made up. And like, okay, case dismissed. So
get out of here.
Wow.
So that's part of the problem, as you know, misinformation. So, and I tried to call the dentist, try to explain what I was doing, didn't want to hear it. So anyway, that was, we're talking 30 years ago. So, so this now come forward to 2023, dentists are much more open to that. Even though orthodontists still do a lot of extraction. So I don't understand why. Actually I do know why, because it's simple, it's easy, it's fast. Get them in, get them out. So anyway, that's kind of the long history of orthodontics and how it's important and why we'd like to do the comprehensive approach, because we can evaluate the airway. Do they have an airway issue? Let's address that. 2, in conjunction with that, let's expand the arches, which is also going to reduce the long-term relapse of orthodontic treatment. And then we put them into aligners or braces, and they got a nice arch. They're breathing well. These are healthier individuals. I mean, we just created a healthier adult.
Yeah. I have a quick follow-up question about breastfeeding for the mothers who maybe want to breastfeed but can't for some reason. What do you suggest?
There are other appliances on the market that can stimulate the same kind of growth and development. Or like I said, we have specific appliances. I happen to use the one from a company called Healthy Start. Because I'm glad you mentioned that, because I almost forgot. One of the reasons they can't breastfeed is they're tongue-tied. So quite often now, more nurses are advanced and understand this, so they'll send them to a dentist, as an infant, right after they're born, to clip that attachment under the tongue, because if they can't push the tongue up against the breast, they cannot expel the milk from the breast. So, and then of course, tongue-tied also creates further problems down the road. Because if you look at the fascia that runs underneath that freedom, runs all the way down to your toes. So that can cause, we've seen this we release the fascia, or release the tongue tie, and the fascia lets go, and suddenly their back pain goes away, their knee pain goes away, just from doing this little clip. It's phenomenal.
Wow.
Yeah.
Amazing.
Wow. It's
So
a
you still
powerful
see
web.
you still see a lot of adults with tongue ties?
Oh yeah. Yeah. It's the
Huh.
the issue with, I think in anything, parents are very pro treatment for their children. They want their children to be healthy. They want them to be the best. They want to be the best athletes, the best students, everything. But when they get to the adult age, I tell them, look, you got a very tight freedom. Well, it's not bothering me. Well, how do you know it's not bothering you? So sometimes it takes a lot of education and time and teaching them like, hey, can you stick your tongue out? And they go, no, I said, stick your tongue out. And they go, no, you can't stick your tongue out. And then I show them the picture of this beautiful graph that was done. It's a picture of the whole fascial plane. It was done. You can actually see it on YouTube. They do the actual dissection. And you can see the attachment under the tongue all the way down the spine, all the way down the thighs to the legs to the toes. So, and a lot of these people, when you release that, they say, oh my God, I had no idea. So they don't know what they don't know, and you experience that, right? People think they're healthy, and then you treat their gut or something and they go, wow, I didn't know I could actually feel this good.
Mhm.
Yeah.
So,
Yeah. Yeah. You're uncovering a lot. I mean, that's a huge web, like Lauren said. So that's pretty impressive. And so back to the kids. So say for whatever reason, the mother can't breastfeed, like Lauren was asking, if that kid does need an appliance, what is the youngest they can do the Healthy Start appliance? 2?
2 years old. Yeah.
Okay.
I think anything younger than that, they're just not going to be able to tolerate it. So,
Mhm.
Yeah.
yeah. And it's interesting because we get some kids, like, we say, like, especially if it's a young boy, say, do you watch hockey or you watch football? They put those things in their mouth. Like, who's your superhero? And you go, yeah, you can be just like
Oh,
Kobe Bryant, or you can be like whatever your superstar is. And then they oh yeah, they put it in their mouth. And then other
Yeah.
kids just
Oh, that's cool.
they fight the whole thing. So it's really motivational, and it requires 100% compliance from the parent. And the parent comes back in and says, oh, well, Tommy just doesn't want to wear it. Like, wait a minute, who's the parent here?
whoops.
You need to have Tommy
Yeah.
wearing this.
Come
So,
on, Tommy. What are you doing?
yeah.
No, come on, mom and
Well,
dad.
pick on Tommy, but
Yeah.
Yeah. I'm sure that's hard. I'm sure some kids really fight back, but I love the hockey idea. I could see a lot of little kids getting into that.
yeah, and we give rewards too if they're wearing it. We come in, we say you've been wearing it, and they'll say, "Oh yeah, I wear it all the time." You look at it, and it has no wear. I mean, these things get worn out, so we know if they're wearing it or not. And I go, "That you're not wearing it."
Uh-oh.
Yeah.
Lie
And
Can't
detector.
lie.
funny,
Yeah.
sometimes a sibling will be in the room. They go, "He's not wearing it."
That's the best lie detector test. Just bring in the whole family. Someone will
Right.
tell.
Somebody will tell.
Certainly. Yeah.
Sounds like something I would have said about Lauren
Yeah.
when we were kids. No, she's still
still
sucking her thumb.
sucking her thumb. Yeah, totally. I'm curious, beyond the breastfeeding, once we have teeth and we start chewing, chewing is really important, right? And the modern diet is just full of soft foods. I love smoothies, but they're soft and they don't require a lot of chewing. And there's just a lot of soft food in general, especially in this country. So what are the implications with not chewing, and what happens to jaw structure as we age, like beyond the breastfeeding age?
Well, there's a normal progression of loss of we call arch length. So our jaws actually get smaller. The teeth don't shrink, so that's one reason why you might see some relapse and crowding in the lower front teeth in age population. So interesting. There's been studies, and it's not new. It's been out for a couple of years. Is those patients that are edentulous, meaning they have no teeth, which means they have to only eat soft foods or smoothies or shakes, they can't chew, higher increase of cognitive decline and Alzheimer's. So there is actually some instant relief from neural inhibition. So we want to stimulate the brain. This is part of it. Because remember, the trigeminal nerve innervates all this. It's the largest of the 12 cranial nerves. It innervates right under the eyes, the upper jaw, the lower jaw, and even into the neck. So if all this is shut off because you can't chew, then you're not stimulating all those other cranial nerves, especially like the vagus nerve. But they've shown cognitive decline and Alzheimer's is increased for people who don't have teeth to chew. So
yeah. I would add to that something I learned recently, that chewing stimulates the release of GLP-1. GLP-1 is what's in all of those drugs, Ozempic, all of the weight loss drugs. They're using them as weight loss drugs, but they really are metabolic syndrome drugs, right? To help your glucose metabolism. And what is like a main trigger of neurodegenerative conditions is metabolic syndrome. So without the chewing, we don't release the GLP-1. People are running to the doctor for a weight loss drug rather than just chewing more.
So is the GLP coming from the saliva? What's causing that?
It's released throughout the body. It's released from many organs, but there's an entire pathway that then stimulates, same as digestion, salivary enzymes begins the process of digestion.
Right.
A piece of it.
So if you're not chewing, you're not getting amylase, so you're not going to break down carbs as well as someone who can chew adequately. Yeah, that's interesting stuff. So the mouth is such an important part of the body that people just take for granted.
Yeah. And I mean, I've said this on the podcast many times, that just like the smoothie thing, I know I'm not alone, but I could just suck down a 20-ounce smoothie with a straw and still feel hungry.
Mm-hmm.
In my head,
I hear that all the
hungry.
Time.
Yeah.
Lack of satiety.
It's so so now I know better, right? I make it a really thick smoothie. I eat it with a spoon, or I like drink it like sludge. But if I'm out and about and I happen to buy a smoothie, and I'm like, I just need to bite one thing and chew it, and I know that signal will go away. Yeah. It's so wild.
You can also, and you probably know this, chew your smoothie. So,
right, that's what I'm saying. I make it like really thick, where it's like
thicker. Add some crunchies. Yeah. I love sprinkling coconut or cacao nibs or nuts on top to force you.
Oh yeah, or
that would really hurt. Bee pollen.
Also, when you suck through the straw, you got to use the orbicularis oris muscles. So you're stimulating those muscles also. So you're getting some musculoskeletal and neural stimulation.
Oh, that's a good thing to use a straw.
It's a good thing.
Yeah.
Oh, but heard
make your smoothie thick, so you have to suck harder.
Right, exactly.
But then you get the wrinkles.
Oh,
the straw
I would rather
wrinkles.
have my brain work and have wrinkles. That's what I choose.
All right.
It's not a panacea.
That is interesting. They're making those large water bottles now with the hole in the top so that you don't have to do that sucking. People are recommending it to avoid wrinkles. I think it's
really
ridiculous.
Yeah. Is that in fact true that causes more wrinkles? I don't know. Yeah. I mean,
you do it enough. I mean
people have these facial muscle exercises. They're supposed to really help. So I don't know how
I think it's actually biting you in the butt in the end, because if you're not then using those muscles or chewing, you're going to have poor glucose metabolism, which will lead to metabolic syndrome, which leads to wrinkles. Yeah. So gotcha anyways.
Yeah.
One way or another, that's going to get you.
Yeah. Well, now there's estheticians that are doing muscle stimulation on the face to get rid of wrinkles. So
yeah. So like the old TENS units that we used to use for muscle stimulation. Yep.
Yeah.
So
crazy. All right.
Chew and suck. Is your advice.
Exactly.
That's the takeaway.
What else do we need to know?
Well, I think when we're talking about sleep, this is an area that I think really has some explanation and some confusion, is what we call AHI, which I talked about before, apnea hypopnea index. So the standard medical is you're saying someone at a 5.1 has sleep apnea, but someone at 4.9 does not. I mean, that's ridiculous. So and just from using other sleep metrics that every night's different. So we do recommend multi-night home sleep studies, because one night just may not give you the information that we really need. So we had a patient came in, he's a biohacker. He says, can I do this 5 nights? I want to collect as much data as I can. I said, yeah, absolutely. I would love for you to do that, because most people are complaining they have to even do it once. So I said, so the more data, and it was interesting. Each night gave us different information. The other thing is, if someone has an existing appliance, let's say something for grinding, we'll definitely do a 2-night, one with it, one without. Great. Again, data is important. You guys stress that all the time, is that sometimes we'll see when they wear the splint, the bruxism goes down, but their sleep apnea gets worse. So this is why you got to be super careful about somebody comes in and says, I grind my teeth. Can you give me an appliance? Or they go to Dick's Sporting Goods and make their own, boil and bite. Then you could actually be creating a more serious sleep issue by putting some appliance in there that's not proper for you. So again, good data. And I said, and then also if someone comes back with a, say, 4.9, say, oh, you don't have sleep apnea, but their Epworth score is like 16, they got a sleep problem. And they know, I'm fatigued, I'm falling asleep while I'm driving. Don't tell me you don't have a sleep issue. So maybe it's upper airway resistance. And the other thing that I've seen is when I do help correct people's sleep apnea, well, when you have sleep apnea, you're usually quite fatigued. So you can fall asleep, you don't even realize it. You're waking up, you're falling back to sleep, you're gasping for air, you fall back to sleep, you wake up, you're tired. When we improved the sleep apnea, now they got insomnia. It's like, so now we created another issue. So that's where, you got to have like a sleep physician, or is it upper airway resistance, whether they need certain nutritions, nootropics, all the stuff that you talk about with helping with sleep, and what Molly talks about in her podcast is that there's so much more to it than just sleep apnea. Sleep apnea basically is a structural issue, but there's so many other things in terms of sleep, sleep hygiene. I don't need to go into all that because you all talk about that and your listeners know about that. And I said, it's not a panacea. So you can correct somebody's sleep apnea. Now, then the question is, what's worse, sleep apnea or insomnia? I mean, I would take insomnia over sleep apnea. Insomnia is usually a long-term chronic issue that's going to catch up with you. Sleep apnea could be one night you have a stroke, you have a heart attack, and you're done. So, the first symptom for many people is one heart attack and they die. So that's pretty risky. People don't typically die of a heart attack from insomnia. They'll create all these other issues, metabolic issues, obviously. And so I think that's important to really address that. And so that's why I said we look at it from a global perspective. It's not just because I know some dentists, the only thing they do is they make everybody a mandibular advancement appliance. They're not looking at the big picture. So I think that's really important when you say, and that's why I love when you say, let's look at the global and then let's bring it down. And then again, I said, it's not the panacea. So if I give you a sleep appliance and you're still eating at McDonald's, you're still eating non-organic food, I mean, you have other issues. And that reminds me kind of a story. A patient came in, he had severe periodontal disease. And I said, well, you're still smoking. That's a contributor, not just to periodontal disease, but other, obviously, respiratory issues. Well, I'm not going to stop. I'm not going to stop smoking. I said, well, then I can't help you with your periodontal disease. So
all you can do is educate. They have to make the choice for themselves, right?
Yeah. So that's, you said, you just educate them and then they decide how important it is. And unfortunately, most of our population does not make active, positive decisions until something happens. So it takes that because, we see the strong correlation between periodontal disease and heart disease, high blood pressure, stroke, but people don't want to do anything about it. Once they have a heart attack, then they want to address it. So let's get on the preventive wagon, but that's not the country we live in, unfortunately. But thankful for podcasts like yours that people are waking up and seeing the difference. I mean, I think people are when you start seeing regular grocery stores having sections of organic food, they're losing market share. So market share is what drives everything. So
yeah. I mean, we're definitely more of a reactive country, but you're right. I think we're changing. And actually, I just saw the other day, there's a new wellness resort in California. Granted, California tends to be a little bit ahead of the curve, but when you check in, you get a Whoop band to track your sleep and everything while you're there for 7 nights. And then they have a sleep expert that will analyze your sleep. They put together your fitness plan, your nutrition plan, everything based off of HRV, resting heart rate, all of these things. And then when you go home, you get continued coaching and you get to keep the Whoop band for a year.
Yeah.
And I'm like, there's probably more resorts around the country doing that. That was just the first one I had heard of. And I'm like, that's pretty cool. I'm sure people are going to be giving away Oura rings and things. So things are changing.
Yeah. I'm wondering if Huberman is behind that. It sounds like his thing.
Maybe. Where does he live?
Who's that?
Huberman.
Yeah, I thought in California, but he's connected to Whoop now, right? Doesn't he have the HRV tracking?
Yeah. Maybe. Yeah. But the resort is like $1,500 a night. So it's not for everyone, but
can't put a price on health.
No. Again, I would say, what's the big global picture? How are they just addressing one section of it? Especially when I hear, and we've had this discussion before about mouth taping. That's like become the big greatest thing, and people are mouth taping when they can't even breathe through their nose. So don't put tape on your mouth and close your mouth if you cannot breathe through your nose. Please address that. So how do you know if there's an issue? Well, again, go back to the comprehensive approach we take. Everyone gets a 3D cone beam. We evaluate every nasal passage. We look at the turbinates. We look at their airway from the nasal passage on down, so we can determine what's the best for you, which may be different than your spouse or your children, or so everybody's a little bit different. But you got to have that information, otherwise you're just guessing, And so a patient comes in, for example, and they've ground their teeth down to nothing. They go, "Oh, I don't grind my teeth." I mean, I hear this quite often. Or they'll say, "Oh, my previous dentist ground my teeth down." I said, "Yeah, I don't think so." So let's do a sleep study. And boy, they're just grinding. They've got, severe sleep apnea, and they're just in total denial. So going back to what I said before, if you take that patient and rebuild their teeth to look like normal teeth that they ground down and not address the sleep apnea, you're creating more of a problem, because now you're giving them more to grind on. So, and I learned that early on when I had a patient came in who had a denture completely worn down, and I tried to build it back up to where it looked natural and couldn't tolerate it. They had adapted to this new, we call vertical position. So I had to bring them up very slowly. When in those days, we weren't even looking at sleep apnea. So I'm sure that person had sleep apnea. So, a lot of good stories. Other stories recently, actually, we see quite often, getting kind of off of the sleep thing, but cavitations and removing abscess root canals. We had a patient just yesterday. She had like no range of motion in her left shoulder. So she couldn't lift her arm more than like that. Did the extraction. She's walking up the hall like this. I mean, immediately.
That was
Arms
an
overhead.
abscess.
So cool.
Yeah.
Abscess root canal?
Yep. Abscess root canal. We see this all the time. We see musculoskeletal things, back pain, lower back pain, knee pain, things go away. So
can you explain that? So there's anaerobic bacteria growing, which causes an inflammatory oxidative stress response. Is that what's happening? And the body goes into survival mode by limiting range of motion?
Yeah, that's part of it, but also the toxins that are being released. So these we call mercaptans and thioethers that are released from the infected tooth or infected cavitation. They then get into the system. So it's a systematic. So it's generally going to attack that sort of the weakest part of the body. So she probably had some underlying, shoulder issues, and it's just so it attacked that. So the also those mercaptans and thioethers, these endotoxins will cause hypercoagulability. So there's thicker blood. It affects the ATP production. We've seen that clearly when we measure enzyme activity. You see lower enzyme activity, especially those who are producing ADP and ATP. So. But but I think there's also an energetic connection. So that tooth was probably on the shoulder, part of the shoulder meridian that runs down here, like the gallbladder runs through the shoulder. So we see that quite often, like with teeth that are on the breast meridian. And women come in and said, yeah, I've been recently diagnosed with breast cancer, or I have lumps or something's going on, and it's on the same side. So it's interesting.
Yeah. And what about the difference between like an abscessed root canal and a quote unquote healthy normal root canal? Like, are you seeing kind of all the same things? Because, people think, oh, it's a healthy root canal.
Right. So that's sort of an oxymoron as far as I'm concerned. And I can say this with confidence because that I did root canals for 25, 30 years. 20 years, 25 years. I stopped in the early 2001. Yeah. So you have to test them. So if someone's saying I'm doing this procedure, like the newest and greatest thing is using lasers and ozone, I was like, wait a minute, I was doing that in the mid 90s, and I thought it was great. I thought I was doing a better root canal. And then they came out with testing. So I would always say to somebody, if you have a root canal, you're not prepared to get it out, it's asymptomatic, have it tested. I mean, it's an easy test. Do the DNA test, see what's growing there. Okay. But I generally find some other underlying thing going on. I see a lot of mold and Lyme patients. And And once we address that, that's like the interference field. So in answer, like Lauren, when you asked about the shoulder, what else is, I mean, there's an energy pathway that's being disrupted. So that's definitely a big issue. So, and that's, you know, we're moving more towards energy medicine, no doubt. So, I mean, people are becoming more aware of it. So, so that's one of the things we see. So we do see that quite often. In the sleep arena, we see patients saying, you know, I'm sleeping better. I'm sleeping through the night. I feel like I'm breathing. And the interesting thing also is that they feel like when they go to the gym, they're breathing better, or they're running, they're breathing better. So it's not just a nighttime issue. When you have an obstructed or small constriction in the airway, it's affecting you during the daytime. The thing is, the baroreceptors in your lungs don't pick it up as well, we'll pick it up so that it adjusts to so that you can breathe. So you're not gasping for air, unless obviously you're running at full speed. But it's not the same as when you're laying down horizontal and everything's collapsing in the back of your throat and you don't have those baroreceptors to protect you. That's when the issues really occur. But think about if we're addressing that problem at night, we're also improving the daytime airway.
Mm-hmm.
Right.
Mm-hmm. Yeah. Fascinating. I wanted to circle back to the cone beam because I think it's just such a cool diagnostic. You can see so much, not just the jaw structure, but like you said, the turbinates, which one, maybe you can explain the turbinates, but they can get inflamed. And I would love to hear all the reasons for that, but also like cervical alignment, how your head is sitting on top of the rest of your spine, which I think in the realm of chiropractors, PTs, personal trainers, a lot of people are talking about forward head, but this is something you really look at. The alignment of the cervical spine, and then how does the nose, mouth, or the lips and the chin line up?
Yeah.
Can you talk about that?
Yeah, I mean, it's all about, you know, body symmetry. So if and another story I'll throw out before I explain that. I remember
like
This is where Renee gets it from.
yeah,
storytellers. Yeah.
when Mom and I used to run 5Ks, and I remember, and I hated running, I still do, but we did it because we knew it was healthy. So, and I remember this man running past me, and he was as crooked as could be. His skeletal structure, but so he had adapted to this weird skeletal abnormality, but he was still could outrun me. And I'm like, this isn't fair. So we can adapt to these asymmetries. Most people aren't completely symmetrical. The more symmetrical we are, and you know that through your experience in training, that the better the body works. And we did some of these things early in the 90s where we were testing athletes by putting appliances in there and balancing out their bite and their TMJ. They actually got stronger. They had better endurance. So it really makes a difference. But then if you go back to the cone beam, you can see that. So for example, we'll look at the TMJ. One will be higher than the other. Now, how can someone function properly when their jaw is not doing this, but doing that? It's going off to one side. So, but because the body's so amazing, it can adapt to these weird things. So when I see that and I explain to a patient, I said, do you have any clicking, popping, headaches, jaw pain? Can you open wide, all this? And they go, no. Then I said, well, then we're just going to watch it. We're not going to treat it. If they are having those problems, then we will address it. And we want to try to create through osteopathic manipulation and using appliance therapy to get those joints balanced. So, but first, what do we need to do? Look at the sleep issue, because if they have an airway issue and they're clenching their teeth, that may be what's causing this asymmetry. The other thing, as you said, Lauren, the turbinates are inside the nose. So the septum comes down the middle. On each side, you got superior, middle, inferior turbinates. They humidify the air, they filter the air, and they produce nitric oxide. So here's another reason why people may have high blood pressure. They're not getting nitric oxide stimulation from the nose, also from the oral cavity. So if you're using Listerine and killing all the good microbiome, that may be a cause. You know, Nathan talks about that, Nathan Bryan. And when I first heard that, he said, by using these mouthwashes, it can raise your blood pressure. I said, you got to be kidding me. And then it made sense when he explained it. So some of these simple things that people were doing, oh, I'm using Listerine, I'm killing the bad bacteria, you're killing the good bacteria. So anyway, I kind of got off on a tangent there, but yeah, so going back to this, what's causing these turbinates to become swollen and inflamed? Environmental toxins and food sensitivities and intolerances. So it's not just the whatever for the dairy, the gluten, the wheat, and the soy. It's so many other things. And I know you all do that testing, which is really important. I think anybody who cannot breathe adequately through their nasal passage, as we talked about before, then they become a mouth breather, and that creates additional sequela that can cause metabolic issues. You got to get them breathing. Got to get them breathing. So, and it's not just about taping your mouth, and it's not about just doing breathing exercises. If you're stuffed up, you got to address, and most of the time, and you guys know this better than anybody, it's a gut issue. So what's going on with the gut? So that's causing you. So I have people will hold one side and say, can you breathe? Yeah. Can you breathe? Yeah. Hold your hand over your mouth. Can you breathe? Mm-mm. Mm-mm. We know they got a nasal passage issue, but then I can pull the cone beam up and we can see these. I mean, I would say 70% or more of my patients have expanded, inflamed, enlarged turbinates. So again, to make it clear, because it's not a panacea, I'll point that out to the patient. I say, you have any breathing problems? We'll go through that exercise. No problem. So the body can adapt to these irregularities. So, but if they do have a breathing problem and we're going to treat their sleep apnea and we're going to use mouth taping, I got to address that first. So do we send them to an ENT or better to a nutrition coach, probably get their gut cleaned up? So,
Yeah. I will say personally, like I had a cold last week and I was so congested, and the hardest thing was sleeping. I cannot sleep if I can't breathe through my nose, and I'm literally laying there trying to mouth breathe, and I can just feel my sympathetic nervous system like revving up. I'm like, there's no way I'm going to fall asleep. So after like a bottle full of xylitol nasal spray, I could finally breathe and sleep. And it's funny, even like Ryan was like, can you try like some mouth tape? I'm like, you want me to die? You want me to die?
hey, get out the duct tape.
Yeah.
Check your life insurance policy first.
Yeah.
That's an interesting point about the
painful.
nervous system, right? Like we do get the parasympathetic downregulation through nasal breathing. So if someone is mouth breathing, we would definitely see nervous system dysregulation, more sympathetic, fight or flight, right? Cortisol dysregulation, which then harms the gut. We get leaky gut. It's just
Goes on and on.
Yeah, never ending.
So the way I explain that to patients, so they fully understand. So when you're running as hard as you can, where do you breathe through?
Mouth.
Yeah, because you're in sympathetic fight or flight. You know.
Yeah, you should be while you're exercising.
Yeah.
Yeah.
So now, ideally, you would train to only breathe through your nose and build up. So I remember that in Ayurvedic medicine that they talked about, only train to the point where you don't have to breathe through your mouth. And then if you continue to do that, and that's assuming that you can actually breathe through your nose. But we talked about food intolerance. What about all the environmental toxins that are out there? I mean, there's so much stuff in the air now. You know, look at the air quality. People, I mean, it's incredible how difficult it is to stimulate the respiratory system. And interesting is that this, where's that article I had? Oh, what you call airway-centric dentistry, they're now calling it craniofacial respiratory complex. So interesting. So this affects this. So if people have COPD or they have other respiratory issues, is it starting here? So, and as you had mentioned just a second ago, the sequela and pathways that occur as a consequence of something that started over here. And of course, our medical community always wants to treat the symptom. So instead of what caused your nose to be clogged up? You know, you had a viral exposure, but these people have chronic. Yours was an acute, Renee, but if you had a chronic issue like that, you got to address that from a more global perspective. And nasal sprays, I recommend people use it 3 or 4 times during the day. Don't just do it while you go to bed. Keep that nasal breathing is so important.
Well, like a xylitol nasal spray or a silver nasal spray, right? Not something like
not Afrin.
Afrin, right, Lauren? Yeah.
We've learned about the Afrin. Don't do it too much, people.
That is an emergency case thing. Yeah. I was actually reading a lot about what do they call it? Congestion rebound
Oh, yeah.
congestion.
Yep,
oh my
Afrin.
Oh my gosh, I was reading some terrible things online. It was frightening.
Yeah, you become
The internet
addicted,
is a
and then it
scary
causes that
place.
rebound effect.
Mm,
Yeah.
yeah.
Where's my
I'm
iPhone?
Oh gosh, yeah. I mean, short term, very short term.
Yeah,
I'm
you got
curious
nothing
with
else.
the turbinates, the inflammation, how often are you seeing clients come in and realize that there's a mold issue, a mold exposure, whether they know it or not? Would you say that's
Um,
on the rise?
Absolutely. And I think it's because of the referral sources I have with other health practitioners that are treating mold, they send them to me.
Ah,
So I end up
yeah.
seeing probably more mold patients than your typical standard dental practice. Mold and Lyme are probably the biggest things because what happens is they hit a certain plateau and they can't get any better. So something else is going on. So and every one of them, even though they're sent to me for, say, cavitations or an abscess root canal to evaluate, guess what I do first? I evaluate their sleep. Always evaluate their sleep because they're not
Mm,
sleeping, you're not healing. I don't care what you
mhm.
have. So you can cure that line, but it's going to be difficult if you're not sleeping.
Yeah.
So,
Mhm.
and
Sleep's
as you
number
said,
one.
Renee, you couldn't sleep because you couldn't breathe. And I remember this conference I went to, and the chiropractor gets up there and he goes, I'm going to tell you now about the number one reason why people don't sleep. And I'm going, yeah, it's airway. He goes, no, it's pain. When you're in pain, you don't sleep. So if you're suffering
Yeah.
from something, you're itching, you got hives, you got some kind of upper respiratory issues, or you have knee pain, back pain, all those things keep you from sleeping. So now we're not talking about, they don't even get into obstructive sleep apnea because they don't fall asleep long enough.
Mhm.
So
Interesting.
whole nother issue. So yeah,
Yeah.
so I think the important takeaway from this is which where you started, Lauren, was the global. Like we're coming back here, but then it just keeps expanding. Like it affects this, affects that, affects the brain, affects the gut, affects the skeletal system. Everything is, there's no one thing. I think that's interesting when you get people who, especially practitioners, who say, "Oh, well, if you just drink this one thing or you take this one product, it's going to solve all your issues." And I'm like, no way,
Yeah.
because somebody took some multi-level marketing product. Well, they were so deficient in nutrient values that they felt better. Of course they did. They finally put something healthy in their body. It doesn't make it a panacea. So
Yeah.
anyway,
And
Yeah.
just that everyone is different. I mean, I'm over
uh,
here raving about the brain tap all the time. I love it. I feel amazing after every time I do it. But I've actually talked to people that say they don't feel it. They're like,
right.
I don't get it. I do it and I don't feel any different.
Uh,
Doesn't mean the brain tap is good or bad. It just, we're all different.
yeah.
So
I mean, I
Yeah.
hear
And
the
I'm
same thing about Russia. I mean, there's people that post like these miraculous things happening, and I'm like, I feel good, I sleep better, but I'm not seeing miraculous effect. So I
yeah.
don't know what, like you said, everybody's different, and there's so many other factors that we just can't compile all of those factors into one bucket. You know,
No
and
way.
we didn't even touch on genetics. So
Yeah. I'm always curious what the behavioral change is that coincides with the device or the therapy, right? Because it's a great illumination to what behaviors maybe cause the symptoms in the first place. So sometimes it's just creating a space in the container for better behaviors. And that's why people feel miraculous. It's like, how do we, yes, I think the device and therapy is invaluable as well, but we have to look at behaviors first.
yeah, and I think that gets into the whole idea of placebo. What's your belief system? Like, what is your personal belief system? Do you buy into what the practitioner says? And does the practitioner actually believe in what they're doing? Because a lot of them will just do what they were taught or trained without really fully engaging in it. I mean, it's like, for example, a physician who's teaching you, the dangers of smoking as he's puffing on a cigarette, or he's talking about obesity and it's got this huge barrel for a gut. I mean, do you really buy into that? So, but if you see someone who, and that's why I always talk about my case, I said, yeah, I'm doing expansion. So they feel like, wow, this guy actually doesn't just preach it, he believes in it. And so if you can get them to buy into that, you have much better success. And then if they have a short-term improvement, then they really buy into it. And just like you all said, everyone's different. I've had some, so I'm not going to say I've had 100% success, I have some patients that just won't wear the appliance. They say it doesn't work, blah, blah, blah. They come up with all kinds of reasons not to wear it.
Yeah.
You can't force people, so that I think is the biggest challenge as a health practitioner. We want to help everyone. We're going to provide information. We know it works for some people. It doesn't work for others. Too many factors, cofactors that we can't control. I'm not going to follow them home and look and stand next to their bed.
Ain't nobody got time for that. Also, that's creepy.
Yes, I'm coming to your house.
Why is Dr. Sam standing next to my bed?
Yeah, with his appliance, smiling at the window. I just want to say, you do walk your talk, because I've seen you in the mornings with your appliance, and I can barely understand what you're saying because he's expanding his teeth.
I'm choking on it. So, but I believe in it. So you put up, and that's reasons why people may not. So, but it's not the same as in your field. Like you want to go to people's house and look in their cupboards to see what they're eating, right? Yeah. So
that would be great.
Yeah. Can you do that on everything? Like you said, that could be a little creepy too. Not as creepy as looking over someone in bed, but
you dead, Sanka? Are you breathing?
Well, that's why
I do it with Rudy, the dog. My dog, the dog.
The dog.
Rudy, I swear he has sleep apnea because he won't be moving. We'll watch him. His chest isn't rising. And then 20 seconds later, he goes, buddy.
Got to get the breath. He's in that fight or flight.
So do you make doggy retainers?
I don't. I've had patients come in and ask me to put braces on their dog. That's like, I don't do that. I don't do
adorable.
Next career.
Yeah.
Next career.
Well, there was one, she had a bulldog. I said, well, wanted to move the jaw back. I said, no, that's characteristic of a bulldog. You don't want to change that.
Yeah.
And surely they've adapted to chew and digest their food that way.
Yeah. They tend to not, guess what? That's what we call class 3. They tend to not have airway issues. So the biggest airway issue is, so class 1 is like this. Class 2, where the lower jaw.
Can you explain for people that aren't watching you?
So class 2, the lower jaw sits way back. People would call it maybe an overbite. So it looks like buck teeth. That's a class 2. Those are the most common airway issues, TMJ issues. Then a class 3, where the lower jaw comes forward and it actually sits outside of the upper jaw. They have less airway issues, less TMJ issues.
Also, and real quick, can you explain alignment of the nose, lips, and jaw? What's ideal?
In a side profile, you want to see the tip of the nose. Now, this can be different for different cultures because some people have large noses, right? So, but typically the tip of the nose lines up with each lip and then the chin. All that should be on alignment. What typically we'll see is the nose and the chin line up and the lips are sitting back. So this is that retraction issue. So we need to bring the jaws forward. So bring jaws forward, brings tongue forward, opens the airway. So, yeah.
I think I have an itty bitty retraction issue.
Well, most people do. They don't know because they're not looking at that. We're looking at the wrong thing. That's why I would say the biggest issue with orthodontics is their goal is to straighten the teeth. We're not looking at function. We're not looking at overall structure. We're not looking at overall health. So if we can address those things, then it makes important. I mean, there's actually the guy who came up with the acronym extraction, retraction, regret syndrome. He pushes these people's, I think too far out. They're like, but they're breathing better. They're breathing better, but you may not want to go out in public.
Maybe good Olympians, like some endurance sports.
But I think the point is that it does make a difference when you move this skeletal structure forward. It's opening up the back of the airway.
Fascinating. Okay. Dad,
all right.
You know a lot.
A lot of food for thought for everyone today.
Yeah,
we'll keep you here all day.
A lot of food for thought that you should chew and suck on.
Yeah, chew and suck.
Yes, there you go.
Yeah.
All right. Well, we still have more questions, so we're gonna have to bring you back again.
Yeah.
I guess we'll have you back.
Annual thing. But Dad, before we let you run, if you can leave our audience with one final piece of advice, something they can start doing today to optimize their health.
My personal advice is be your own guru. Do your homework. I know you guys talk about that, but I really believe in that. There's just too many experts out there who get caught up in one thing, take this one thing, do this one thing. And I don't want to say, I said, treating what we do is not a panacea, because I mean, I can improve their airway, but if they have poor gut health and they can't breathe through their nose, it's only part of it. So you've got to do your homework. Don't get sucked in. And when I say guru, not just on a physical, emotional, mental, and spiritual. There's a lot of spiritual gurus out there that will lead you down the wrong path. So be yourself. You have the innate wisdom to make the right decisions. Trust your innate wisdom. Trust it. So I'm not saying don't listen to anybody. You have to just do your own homework. Say, does that resonate with me or not? If it feels uncomfortable, then don't move in that direction. I mean, I don't care if someone says I've treated 1,000 people and I've had 99% success. If it doesn't resonate with you, move on. No.
That's great. I love that so much. Thanks, Dad.
You're
Thank you,
welcome.
Dad.
Now, unless I'm the guru, then you want to follow everything I say.
Yeah. We've always
Don't listen to
everyone.
anybody, but listen to me.
That's right. Well, you know there's people out there like that, right?
Yeah.
Right.
Yeah.
Yeah. I am the
So
guru.
can you tell our audience where they can find more of you?
Yeah, right here. See? It's all of me.
On YouTube.
Yeah, go to juliandentist.com. You can see me on Instagram, on LinkedIn, Twitter. I'm still on there. For a while I wasn't.
Threads?
Where?
You on
Threads.
Threads yet?
Yeah.
No.
No, I don't have Threads. So I'm easy to find. Julian Center or juliandentist.com. But I also have 3 or 4 other websites to deal with implants, ceramic implants we didn't get into. There's one on sleep, Julian Center for Sleep. I think it's Julian Center for Effortless Sleep. And then one Julian Center for Toxic-Free Dentistry. So
Yeah. We'll
Great.
link to all of those in the show notes.
okay.
I just want to add, this is not just for local support. People fly from all over the country, potentially some even out of the country, to see you, right?
Yeah.
So you do not have to live in Maryland.
No, that's
You do have to travel, but
So, I mean, that just has to do with people's priorities. I mean, I have people that probably live right across the street. They're not going to come to me because I'm not open at night. I don't think their insurance, whatever. That's whatever they're looking for. But as you said, I have people that actually fly from out of the country to come here. So thanks for bringing that. It's good. Yeah.
it's important. Thank you so much for joining us. This is a lot of fun and super educational.
Well, I
As
always learn
always.
from you too. So I learned something today. It was great.
Teamwork.
Me too. We always
Yeah.
learn
Love you,
from each
girls.
other.
We
All
love
right.
you.
Yeah.
Love you, Dad.
I love you. You're doing a great job. Thank you.
Thanks. And thanks to everyone for tuning in. We will see you next time.